Tonight's episode is a special. Tonight we're talking about anxiety, what it is and what it's not, and how it ultimately affects our performance in law school. We're also going to talk about how to take care of our mental health so we can all do better in law school. All of this and more coming right up. Hi, my name is Lex and welcome to Lex in Motion. In this channel, I'll be helping you build your competence, confidence, and capability in law school. Start today by hitting the subscribe button below. New episodes are posted every Friday. Tonight, we have a special guest from the Department of Health. He is a Senior Health Program Officer for the Department of Health and has been with the department for over 3 years. Please join me in welcoming Mr. Amadeus Fernando M. Pagente.
Good evening, everyone. Thank you for having me in your channel.
Thank you for this wonderful opportunity, Sir Mads. Thank you. Maraming salamat talaga for joining us tonight, and we would like to welcome you tonight in the Lex in Motion community. Our first question tonight is about anxiety. Can you walk us through what anxiety is?
Well, anxiety is a normal reaction to stress and can be beneficial in some situations. It can alert us to dangers and help us prepare and pay attention. Anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. It includes disorders that share features of excessive fear and anxiety and related behavioral disturbances. Fear is the emotional response to real and perceived imminent threat, whereas anxiety is anticipation of future threat.
You've mentioned that anxiety is different from nervousness. Ano naman po ang kaibahan ng anxiety sa, say, normal feelings of sadness?
Sadness is a normal emotion that everyone will experience at some point in his or her life, be it the loss of a job, the end of a relationship, or the death of a loved one. Sadness is usually caused by a specific situation, person, or event. When it comes to depression, however, no such trigger is needed. A person suffering from depression feels sad or hopeless about everything.
You've mentioned depression, Sir Mads. What does depression mean from the point of view of mental health practitioners? How is it different from anxiety or normal feelings of sadness?
Well, depression, otherwise known as major depressive disorder or clinical depression, is a mood disorder. Those who suffer from depression experience persistent feelings of sadness and hopelessness and lost interest in activities they once enjoyed. Aside from the emotional problems caused by depression, individuals can also present with a physical symptom such as chronic pain or digestive issues. The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure. It is normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve these intense sadness and withdrawal from usual activities. They are also different in important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood and or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. In grief, thoughts of death may surface when thinking of or fantasizing about joining the deceased loved one. In major depression, thoughts are focused on ending one's life due to feeling worthless or undeserving of living, or being unable to cope with the pain of depression.
How do we know that we're actually suffering from a mental health condition versus the normal day-to-day strains of living in a pandemic?
Well, multiple social, psychological, and biological factors determine the level of mental health of a person at any point of time. For example, Violence and persistent socioeconomic pressures are recognized risks to mental health. The clearest evidence is associated with sexual violence. Poor mental health is also associated with rapid social change, such as stressful work conditions, gender discrimination, social exclusion, unhealthy lifestyle, physical ill health, and human rights violations. Mental health promotion involves actions that improve psychological well-being. This may involve creating an environment that supports mental health. An environment that respects and protects basic civil, political, socioeconomic, and cultural rights is fundamental to mental health. Without the security and freedom provided by these rights, it is difficult to maintain a high level of mental health. National mental health policies should be concerned both with mental disorders and with broader issues that promote mental health. Mental health promotion should be mainstreamed into governmental and non-governmental policies and programs.
Speaking of taking care of our mental health as a collective, as a body, and as a nation, what steps have or are being taken by the department towards this direction?
Well, there are specific ways to promote mental health, including early childhood interventions, providing a stable environment that is sensitive to children's health and nutritional needs, with protection from threats, opportunities for early learning, and interactions that are responsive, emotionally supportive, and developmentally stimulating. Support to children. For example, life skills programs, child and youth development programs. Socioeconomic empowerment of women, such as improving access to education and microcredit schemes. Social support for elderly populations, befriending initiatives, community and day centers for the aged. Programs targeted at vulnerable people, including minorities, indigenous people, migrants, people affected by conflicts and disasters, for example, for psychosocial interventions after disasters. Mental health promotional activities in schools, programs involving supportive ecological changes in schools, mental health interventions at work, such as stress prevention programs, housing policies, for example, housing improvement, violence prevention programs, like reducing the availability of alcohol and access to arms, community development programs, like integrated rural development, poverty reduction and social protection for the poor, anti-discrimination laws and campaigns, promotion of rights, opportunities, and care of individuals with mental disorders. Knowledge of what to do about the escalating burden of mental disorders has improved substantially over the past decade. There is a growing body of evidence demonstrating both the efficacy and cost-effectiveness of key interventions for priority mental disorders in countries at different levels of economic development. Examples of interventions that are cost-effective, feasible, and affordable include: number 1, treatment of depression with psychological treatment and for moderate to severe cases, antidepressant medicines. Number 2, treatment of psychosis with antipsychotic medicines and psychosocial support. Number 3, taxation of alcoholic beverages and restriction of their availability and marketing. A range of effective measures also exist for the prevention of suicide, prevention and treatment of mental disorders in children, prevention and treatment of dementia, and treatment of substance use disorders. The Mental Health Gap Action Program, or MHGAP, has produced evidence-based guidance for non-specialists to enable them to better identify and manage a range of priority mental health conditions. More often, family, friends, teachers, and individuals themselves begin to recognize small changes or a feeling that something is not quite right about their thinking, feelings, or behavior before an illness appears in its full-blown form. Learning about developing symptoms or early warning signs and taking actions can help. Early intervention can help reduce the severity of an illness and it may even be possible to delay or prevent a major mental illness altogether.
These are all wonderful programs, Sir Mads, and we hope to see more of the same. Reach more people, especially those of us here in the provinces. Let's take a minute now, Sir Mads, to talk about our mental health as individuals. Our lives in law school typically involve hours and hours of reading and writing alone. During class hours, we find ourselves suffering from feelings of anxiety and nervousness during recitation. We understand, of course, that this takes a huge toll on our mental health in the long term. Paano po namin malalaman na this is it, I am now suffering some form of mental health issue and I need help?
If several of the following are occurring, it may be useful to follow up with a mental health professional. Sleep or appetite changes, dramatic sleep and appetite changes or decline in personal care, mood changes such as rapid or dramatic shifts in emotions or depressed feelings, withdrawal, recent social withdrawal and loss of interest in activities previously enjoyed, drop in functioning, such as an unusual drop in functioning at school, work, or social activities, such as quitting sports, failing in school, or difficulty performing familiar tasks. Problems in thinking, problems with concentration, memory, or logical thought and speech that are hard to explain. Increased sensitivity, heightened sensitivity to sights, sounds, smell, or touch, or avoidance of overstimulating situations. Apathy, loss of initiative or desire to participate in any activity. Feeling disconnected, a vague feeling of being disconnected from oneself or one's surroundings, or a sense of unreality. Illogical thinking, unusual or exaggerated beliefs about personal powers to understand meanings or influence events. Illogical or magical thinking typically of childhood in an adult. Nervousness, fear or suspiciousness of others or a strong nervous feeling.
Naku, maraming salamat, Sir Mads. Ibig po bang sabihin na kapag meron ako ng dalawang signs and symptoms na inyong nabanggit, like changes in my sleeping patterns and my appetite, at yung hirap po akong mag-isip, mag-aral o makaalala ng aking mga inaral, is it now time for me to consult with a mental health professional?
Well, one or two of these symptoms alone can't predict a mental illness but may indicate a need for further evaluation. If a person is experiencing several at a time, and the symptoms are causing serious problems in the ability to study, work, or relate to others, he or she should be seen by a physician or a mental health professional. People with suicidal thoughts or intent or thoughts of harming others need immediate attention.
Let's now take a minute, Sir Mads, to talk about the mental health law. Who is it for? What does it entail for us and for society in general?
The law aims to establish a national mental health policy directed towards improving the health of the population in schools, workplaces, and communities, underscoring the basic rights of all Filipinos to mental health. It also highlights the balanced delivery of mental health services, such as in the community-based and hospital-based mental health services, with more focus on persons with psychiatric, neurologic, and psychosocial health needs, and overcoming society's attitudinal challenges that they may live free from stigma and discrimination. The Implementing Rules and Regulations, or IRR, is a result of several public consultations and productive discussions with different government agencies, which include the following: Department of Education, Department of Labor and Employment, Department of the Interior and Local Government, Department of Social Welfare and Development, Technical Education and Skills Development Authority, Commission on Higher Education, Commission on Human Rights, as well as champions at the lower and upper houses of Congress and medical associations. The law grants protection to persons availing psychiatric, neurologic, and psychosocial health services by recognizing their right to access evidence-based mental health services at all levels of the national health care system, free from stigma and discrimination. Their family members, caregivers, or appointed legal representatives by recognizing their right to receive appropriate psychosocial support and participate in all activities involving the service user, while reinforcing the mental health professional's right to a safe and supportive environment, and to participate in continuous professional development programs.
Overseeing the implementation of the Mental Health Act is the Philippine Council for Mental Health. Can you tell us more about this?
Well, the law establishes the Philippine Council for Mental Health, or the PCMH, as a policy-making advisory body mandated to develop a national multisectoral mental health strategic plan and to ensure its implementation through monitoring and evaluation of policies and guidelines. DOH has launched a multisectoral approach for mental health with programs and interventions across a variety of settings, such as in the workplaces, schools, and communities, specifically aimed at high-risk groups.
Ano-ano po ang mga recent na programa ng Kagawaran ng Kalusugan para sa mental health nating mga Pilipino?
Well, the development of a multisectoral national suicide prevention strategy, which includes psychosocial services such as the NCMH Crisis Hotline, Kamusta Ka? Tara Usap Tayo, launched last May 2 of 2019. The hotline is now available 24/7 for prompt psychological first aid. The UP Diliman Psychosocial Services, UPD PsychServe, has also provided free counseling via telephone for frontliners. RA 11036, or the Mental Health Act, mandates the provision of comprehensive suicide prevention services encompassing crisis intervention and a response strategy on a nationwide scale. Recently, the Department of Health, in collaboration with USAID Renew Health, launched on October 15 the Lusog Isip app as the first mobile application for mental health and self-care for Filipinos. The following are some of the programs of DOH. We have the PhilHealth Benefit Package. We also have the Inpatient Mental Health Benefit Training Packages, the Mental Health Gap Action Program, or the MHGAP, Tulong Alalay Gabay, or otherwise known as the Community-Based Mental Health, and the WHO Quality Rights.
Maraming salamat po sa pagkakataon na tayo ay nakapagkwentuhan kahit sandali lang.
Maraming salamat din, Lex. Thank you very much. Mabuhay and have a #Healthy Pilipinas.
This episode was brought to you by the Department of Health and Google Asia Pacific. Salamat kapatid kung inabot mo ang ending ng episode na to. Salamat din kung kahit papaano ay may natutunan ka dito. If you would like to see future episodes on how to take care of your mental health while in law school, let me know by typing yes in the comments down below. Thank you so much for watching. Like and share this video for Good Law School Karma, and I will see you next Friday.